Good morning, everybody. This is Michael from Spades Consulting. We are going to talk about health insurance real quick because I think I mentioned it in another video. I don't even know if I posted it yet. Now that the SNAP EBT cuts happened, apparently the subsidies for health insurance are also going to be expiring shortly, and most people are looking at double to triple what they were paying for health insurance now. So, for people who haven't necessarily figured it out yet, and honestly, it is subject to change, but this is my reading of it. I think at this point, um, I'm fairly certain that the plan is to literally just pull one by one all of the supports, all of the federal supports out of the system. And from that, cause, stage by stage, a planned demolition of the entire financial structure. Um, it's kind of necessary. So when it comes to all the people who are furious that, they were paying $800 a month for insurance, that's assuming they're getting insurance out of pocket, not through an employer. Although, to be fair, there are a good amount of employers who really do not put a whole lot of money into health insurance, and they just have it there as an option to say they have it. But it ends up really not being worth it. The arguments, from going 800 to 1600, 2400, just however much. Honestly, a lot of the quotes I've been seeing is like $2,000-$3,000 now, and it's just like, wow, that is impressive. And a lot of people, of course, they're not happy about it, and I get it. I totally get it, especially if you are in a position where you are not the healthiest, whether that be from personal choice or whether that be through genetic happenstance. I know plenty of people on both sides. Regardless, when you go back to Obamacare and the whole idea of the federal government essentially backdoor subsidizing all the health insurance companies, essentially what the government has been doing, mostly under Democratic rule, or at the very least, you do have to give me this if you're a leftist, that each side, quietly supports the fiefdoms of their supporters. Knowing this, or at least getting a decent understanding of this, there's no reason, and both sides can agree to this, there is absolutely zero reason that health insurance should cost as much as it does in this country. Um, there's no reason why you should, especially with how high rents are right now, there is no good goddamn reason health insurance should cost as much or more than people's rent right now. All right. But when we take the subsidies into account, we really get a solid picture. That difference, that increase that you're seeing now, that is how much money has been being just quietly handed to the health insurance companies. So their executives and their boards of directors and their higher level staff can live like kings while everybody else has to deal with the insurance auditor walking in while you're in a hospital room looking for things to cut, all right, or forcing you to cough up more and more copays. I mean, deductibles are, of course, through the roof, and that's another thing that's going to be going up. Deductibles as high as 20,000. Wow, wow, that's impressive. Now, I know a lot of people who have given up insurance, and it's going to be a lot more people. Honestly, if you legitimately don't need it, if you can get by without it, just not medical, legal, or financial advice, just do it. Just do it. because it makes no sense to pay that much money for a just in case service. Okay? Now, given mm, you never know when you are going to have a medical event, medical emergency. You have no idea. Nobody does. All right? But for the most part, the average person is relatively healthy enough and stable enough that you can't justify those prices. So now that these subsidies are going to be going away, this means two things. This gives a couple choices to the health insurance companies. One, they can either stop feeding themselves till they're obese, just hogging up the trough. They can either give up a large chunk of money that really they should not be, quote unquote, earning. They're either going to have to give up the higher lifestyle and actually provide people with decent medical care in this country, or they're just not going to have anybody taking on the insurance. I mean, you can't really have a service if you have no customers. If nobody's willing to pay for the insurance, then oh well, I guess Blue Cross is going to go out of business, or whichever insurance carrier, Kaiser, Permanente, any of the big ones. And honestly, it's healthcare has been a racket for a long time. And like for example, if you go to a dentist's office, most of the X-ray equipment that they use on you is actually leased. It's leased, it's rented, but normally it's attached to a service plan. So they pay X amount a month so they can have the ability to do x-rays. And then if anything goes wrong with the machine, they don't bear personal and insurance liability for it if it ends up double dosing, triple dosing, or giving somebody otherwise healthy cancer. Okay. Or, related, what would it be? Degenerative diseases. The dentist wouldn't, have personal liability in that case. They could shift it off to the company that provides them the radiological equipment. It didn't used to be like that, but the upside to it outside of the liability part is they also tend to get newer machines instead of, 40-year-old machines that are almost definitely going to be blasting way too much radiation than is needed to actually get a solid look. It is like that with just about every major piece of equipment. Anything that could possibly go wrong. The MRI machines are most likely all connected to lease agreements. They have companies that, they just pay a monthly fee, they get a machine, and the machine does its thing. Anything goes wrong, they call that company. And a lot of the economic activity in healthcare and outside healthcare is based on that separation of liability to continually break all of the little pieces, all of the little things that you would hold liability for if anything goes wrong into businesses of their own. The costs go up, but overall costs go up, but the benefit there is generally a benefit, newer machines, nicer, shinier features, and it's just like okay. The only issue is that recently, as you see with cars and parts for elevators, apparently, and quite a few other things, part quality has fallen off a cliff. So you never know. You might end up seeing more and more people run into issues when they get x-rays or anything else done just because, yeah, it's a shiny new machine and it's also creatively broken. All right. Back to the point, though. there's no reason health insurance should cost this much. There's no reason why um, federal money should be going to subsidize all of these companies to not just provide, basic services, but to literally fund their multi-millionaire lifestyles all around the world. All right. And then on top of it, this runs into lefty territory, but it, god damn it. Honestly, there should not be anywhere near as much profiteering as there has been when it comes to pharmaceuticals. I mean, first and foremost, if you don't need to take a pill for something, don't. One of the more common ones that you'll see. So for a while, there was a Voltaren gel. All right. If anybody you knew in your lifetime, say 20, let's say, oh God, I forget when it came out, but I want to say it was like the 2010 era. Just about every old timer was getting tubes of Voltaren gel thrown at them left and right. And it was, essentially cleared to just give away samples and of these giant tubes of Voltaren gel that would, deal with aches and pains, standard arthritic pain that would come with being old and crunchy and crispy. Okay? The thing is, Voltaren gel is essentially it's just like a leave, except like 10,000 times more powerful. So the consequence of using Voltaren gel that came out was a higher risk of heart attack and stroke. All right. Now, so much of that was distributed into the country, but even though things like Voltaren are now regulated for the most part, and you have to essentially get a prescription for that. And believe me, I know old timers who were literally rubbing it everywhere. And it's just like, hey, good luck with that. But people don't necessarily think that something they're going to get as a free sample essentially is going to kill them. But they now make the pill versions of Voltaren, and with the end or the increasing control of opioid painkillers, now you're starting to see more of the Voltaren in a pill being dispensed. And it's just like, does it work? Absolutely. Absolutely, it works. Would I be comfortable taking it? Oh, hell no. Hell no. And that's the thing. So far, knowing exactly what it is, anytime I've been prescribed that, never take it. Never. Although at the same time, I also have a pretty good pain tolerance. So, regardless. God, where was I going with shit? My apologies. Oh, how much they're actually making on these drugs. So things like going back to the coof days, I don't even know if it's okay to talk about. I forget which one it was too. Oh damn it! What the hell was it? Oh yes. So the one thing that you could get as a that most people were getting through Amazon and other online marketplaces. It's a product normally used for horses. It starts with an I and ends with an N. That had been used for ages without problems, for quite a lot of things. Now, left or right, doesn't matter. This is not a political thing. But that drug is a generic, all right? It does not, like, you can make like 10 for a dollar in terms of production. It's incredibly cheap, all right? So of course, the incredibly cheap option at a time where people are panicked and you can make a fortune off selling them healthcare, whether it's in pill form or in person. Uh, that drug was too cheap, not enough profit margin. So, what companies ended up doing was they took that and they made their own modification to create, quote unquote, a new drug with a new name. And they got doctors prescribing that new drug, wink, wink, under the new name, where instead of maybe, oh God, maybe $20 for 1,000 pills, that'd probably be the split for it. Um, you were paying $100 a pill. All right. That level of profiteering is honestly criminal. It's honestly criminal. And it goes to the issues with, oh God, EpiPens and insulin. There is no reason that EpiPens and insulin should cost a fortune, but it's a pinch point because they know if you don't have it, you die. Okay? The guy who created the process to make insulin, I forget how it actually goes, but I know in his testing he was essentially deriving insulin from pigs. And he created a stable process with the idea that he would be able to, that the drug companies would essentially pump insulin onto the market so people wouldn't die. And of course, they decided to paywall the hell out of it, and it's a multi-million dollar, if not billion-dollar business on its own just based on that. If you go to a pharmacy in China or in Mexico or anywhere else, okay, you don't even need a prescription most of the time, or any of the time. It depends on where you go. It depends on which countries, but a lot of countries, you can literally just walk in and ask for it, and you can get it, and you're paying damn near nothing for it. In the US, you're paying through the nose, you're paying out the ass for every single little thing. Now, I know that Big Orange Man supposedly has been working on things to try to get the cost of prescription pills down, which is great. Which is great. It's a good step. It's a nice step in the right direction. But healthcare as an industry, healthcare as an economy in its own, it needs to collapse. It needs to drop. All right. And with the SNAP benefits, not too many people, I haven't heard a lot of people throw out the idea that the SNAP benefits themselves aren't necessarily cutting them and this whole shutdown bullshit. Not too many people have really come up with the thought, the idea that maybe the whole plan behind that is to stop the grocery stores and from the grocery stores all the way down to production to stop the price gouging at every single level. It's just like, oh, you want to price gouge people? Okay. Well, we'll kick out the supports so you can't price gouge anymore, and you're going to have to sell food at a reasonable profit versus obscene profits. Essentially, how else would you break the market economy? How else would you stop profiteering at every level other than to literally choke the demand to death or near death? Okay? It's not pretty. It's not nice. It could absolutely fucking wreck everything. But if it gets the job done, and if it gets the job done with as few casualties as possible, ideally none, but if it gets the job done, something had to be done. It's with healthcare, with housing, with education. I mean, healthcare and education are the perfect example because healthcare is just the same damn process as education prices going through the roof. There's no reason why a college degree should cost as much as it does. All right. The only thing that got it there was the fact that the government would literally, not given, I know it's not all government, a lot of people go into private debt for education, but a good chunk of public money was going into these colleges. And it's just like, oh, that money is practically guaranteed. So we'll just raise the rate. We'll just, if they're going to give us 6,800 to quote unquote educate this person, regardless of the field, if they're going to give us 6,800, you know what? We could just raise prices 6,800 and there we go. It's cash in the bank. It's victory. It's winning. It's better facilities because every college needs a pool and a Copacabana or whatever the hell they need. This, God knows I've seen too much of this where in, the college towns, you go to a college town and literally the college owns half the town. And it's like, really? Really? If the funding ever stops, like, you're not going to be able to prop up all of this, right? It's just like, don't worry about it. The funding will never stop. Well, the funding's stopping. All right. It's stopping on one end, and people are just thrown in the towel because so many people have gone to college and gotten little to no benefit or actually put themselves in a much worse position that nobody's doing it. So it's not the nice way to do it, but blowing up the demand side of economics is a hell of a way to get prices back into check and stop the rampant profiteering. It's just a question of how long, how far, and how deep is it going to go. Um, as a side note, though, when it comes to the government shutdown, because I suppose I do have to talk about this, I know a lot of people, and I've seen quite a few comments in my own just browsing through. Well, if the government can decide to pay themselves and not work, why the hell are we paying taxes? Honestly, that's a very reasonable way to look at it. Honestly, this comes back to the idea that the government is increasingly, the federal government is becoming no longer relevant in normal people's lives. Like, yeah, there's Social Security for the boomers, but for anybody else, you're good fucking luck. You're on your own. By the time you get old enough to collect, shit, they might have firing squads on all of us by that point. That's the thing. Once the boomers have looted what's left of the system, you know, I do run into the average boomer, and one of them, oh god, the other day, I swear, hearing the words "We're all in this together" from a generation that looted and pillaged the entire country and continues to loot and pillage the entire country, and it's just like, yeah, bud, we're in this together. Yeah, rightio, idea. Yeah, no, we're not in this together. We're not. We are not, because once the boomers are finally gone, uh, God, the U.S. will probably be 60 trillion in debt, and that's not even accounting for hyperinflation. Like, yeah, we're all in this together. Hey, we loaded the entire thing, the entire federal budget with gunpowder, and oh shit, one of us dropped a match. Like, really, really. So, for the most part, honestly, it's done. It's over. Um, honestly, this comes back to what I've been saying for a while. Just do the best you can, and don't fall prey necessarily to one ideology or the other, because there is no guarantee. Like, there are essentially, for the most part, a lot of the people on the right and the left, a lot of the people, it's they're vultures arguing over the last scraps on the corpse. Okay, that's really what it comes down to. Like, there's no accountability. There's none of it. None of it. For the most part, it's just like which side is going to get the last scoop of ice cream before they have to come out and admit, oh shit, we ate all the ice cream. Sorry, guys. There's nothing left to fight over anymore. All right, we can cling to the vestiges of the old days in the past, but the America from even 10 years ago is dead and buried. Okay, what we have now, I mean, a lot of people refer to it as the banana republic, but honestly, what it comes down to is even if we don't end up in the civil war that a lot of people are just edging to, the idea of, even if we don't end up with something akin to that, what we are going to see is as the federal government increasingly cannot come, mm, cannot, what would be the term? Oh, shit. Oh, damn it. All right. We'll dance around it. Um, as the federal government proves out to not be able to come through with their end of the bargain and without hyperinflating, oh yeah, we're totally paying the debts off. Yep, everybody's getting their Social Security. Everybody's getting their benefits. Everybody's getting everything. Everything is fine whilst they run the currency into the dirt and the benefits buy you nothing, and they start looking at all the retirement plans like, oh, you didn't earn that. You know, what's going to happen is as the government cannot keep to its promises that it's made, the boomers and every other generation after, but mostly the boomers, the federal government's just going to become less and less relevant, and things are going to shift to the states to handle most of the most of the fallout. All right, and then if the states can't handle it, then it will collapse down to a more local level where people in specific cities or counties, or well, county level too, and then down to the ultra tight knit local level. Things will just continually collapse down to control being in fewer and fewer hands until people actually can get a grasp around it all and we can actually start producing shit again. All right. That honestly, that's what I expect. Like, yeah, most people they'll look at the big picture and it's just like, I get it, I get it. Believe me, I was there 10 years ago thinking about the big picture. All right. I was thinking, I mean, Jesus Christ, I was thinking about the big picture way more than 10 years ago. But, what it comes down to is you've got everybody chasing after everybody wants to throw on the crown. All right. And everybody's got an idea or a solution, but honestly, it's too big. The problems are too big, they're too complex, and for the most part, they can't be dealt with in any nice, clean, easy way. Because the entire system has been built on essentially nobody ever has to lose. Okay? And this ties into healthcare, it ties into everything in economics. Okay? The banks were too big to fail, the boomers are too big to fail. The colleges, for the most part, too big to fail. Everything's too big to fail. All right? Nobody's allowed to lose. But the problem is we haven't actually had an economy that is produced enough to get us past the reality of things becoming a zero-sum game. It's like, yeah, you can make 100 cars, but you also pollute the environment in the process of making that 100 cars that you end up paying the cost one way or another. And then, oh no, the crop yields are down, or oh no, all the fucking workers are sick because the farm in North Carolina, the pig farm in North Carolina or South Carolina, the runoff made it to the rivers and soaked into the local water supply, and now everybody's sick with multiple diseases, and you have the healthcare costs to that and the impact to that. What it will eventually come down to is everything will just go to a local level as the wider downfall continues, and the same people who are fighting to wear the crown now are going to be fighting to wear the crown tomorrow, just thinking like, oh my God, oh, if only I had the reins of power, I'd change things. Like, no, you won't. No, you won't. There's too much power, there's too much money, there's too much everything chasing after the crown. Um, it doesn't matter if you have a good heart and the right intentions, everybody has a price. And it doesn't matter if you manage to not be bought off if everybody around you is, because you as an individual can't keep track of everything. And knowing that you can't keep track of everything is only half the battle, because if the people around you who are supposed to be tracking these individual issues and things are bought off and start feeding you bad information and bad ideas, then everything goes to hell in a handbasket. God, I've gotten off topic. My apologies. But anyway, healthcare system. Eh. Oh God, what the hell? What the hell else can I say about the healthcare system? Get healthy, stay healthy as you can, and it's a thing. They're either going to have to lower the premiums, either the health insurance executive class is going to have to accept less, including the hospitals. Either they're going to have to accept less, or they're going to have to eat shit and die. They won't have business models anymore. All right. Honestly, I kind of wonder what some of the old employers I've had in the past, I kind of wonder what they're going to do about the health insurance, because some of them actually paid a good amount of it. And with the idea of it doubling, like, I know they're not going to want to afford that, the doubling. They're not going to want to pay that. So I wonder how things are going to go for them. But regardless, get healthy, stay healthy, make good decisions, do the best that you can, and I wish you all of the luck in surviving whatever fucking swamp creature abomination, whatever this downfall is going to look like. And with that, we'll end it here. I've been Michael from Spades Consulting. If you are interested in personal or business advice, by all means, the site is available, or, well, there's openings on the calendar. Check us out on Substack. And if you like the video, like and subscribe if you so choose. I will see you guys next time.